Welcome to the BDI Empowers podcast, where experts simplify disability benefits so you don't waste years figuring them out. Now, get empowered.
As children with disabilities grow, moving from pediatric to adult healthcare can be challenging and requires a lot of planning. This session is designed to support parents and caregivers of medically fragile children and adults with developmental delays in navigating this critical transition. In 2003, Blessing Udo, PhD, RN, became a mother to twin girls. One of them was medically fragile. Her journey through months in the NICU, multiple hospital stays, and the emotional toll of caring for a fragile child led her to create a pediatric home care agency built on compassion and quality. Now, she brings her experience and insight to help other families navigate the road ahead. What you'll learn: when and how to start planning for the transition, how to involve your child and build independence, what changes to expect in care models and providers, and building a strong, coordinated care team. This episode is presented by Kind Touch Healthcare Services.
Every child is different, depending on the diagnosis, and physiologically, things are changing, right? So let's talk about why transitioning is important, because transitioning addresses the changing medical and developmental needs of your child. As they grow, things change, the structures of their body changes, their needs changes. And so that's why there has to be that transitioning period in order to ensure that they're getting the right kind of care for where they are in their lives in that moment. So transitioning promotes self-reliance. It helps your young person become a responsible adult for their own health care. We will not always be there. As parents, you want to be there for your child all the time, but there may come a period when you're not there. How do we then get them ready to be able to handle that period, developmentally, physically, and in every way? Also, transitioning ensures that there is that continuity of care, that something doesn't drop along the way, that if your child was being seen for respiratory issues, they are continuing to be seen as an adult for those issues, especially if it didn't resolve. Someone has to know their history so that when something happens, they can pick up where they should, and there is no gap in the care that they receive. We'll talk about the key differences between pediatric and adult care. In this moment, when you come to the clinic or you go to the hospital or you're seeing a therapist, everyone is involved, right? You answer the questions, you make the decisions, you're the one signing all the documents. This moment, when there are babies to that, about that 18, 20, even to 21 years of age, the care is really focused on development. Are they meeting their developmental milestones? Did they crawl when they should? Or because of their health diagnosis or medical diagnosis, are they meeting whatever kind of milestones we expect them to meet, considering where they are, considering their diagnosis? How are they doing that? And the people who can help us as providers to understand that is you. Whoever you are that is a primary caregiver of that child, you make the decision. But then when we begin to transition to adults, we're thinking autonomy. We're no longer expecting you to answer all the questions. So at that point, we're transitioning from milestones and developmental expectations to chronic illness. So our focus is more on the child, on the young adult, no longer a child at this moment. And so it's no longer on you. And this is one of the most difficult periods for parents. I know it was for me to hold myself back when we're talking to the physician or the practitioners, that I don't want to answer all the questions, that I'm allowing my kid to answer the question, and understanding that this adult phase is totally different. Some of the things that I have experienced and have seen with a lot of our clients that were not prepared are the gaps in care. A lot of our kids that are on the GAP program, that's the Georgia Pediatric program, at age 21, they're transitioned out of GAP. And during that period, they transition out of everything: insurance, all the providers, like their PTs, their OT, all of their therapies. There's a transition that happens. So if you're not prepared, there's going to be that period when transition occurs and there's a gap in service because we weren't ready. They're not getting the doctor's visit, their dental appointments, their psych appointment, all of those things, everything is in upheaval. And you have that moment when the young adult is not getting the care that they should. Another thing is a family struggle. Children and families experience emotional stress, and it is so difficult trying to navigate this new unfamiliar territory. It's emotionally stressful for you as a caregiver, and it is stressful for the child or the young adult, because when you are stressed, they feel it. They sense that things are not the way they should. They're noticing that they're not going to their appointments as they should. They're noticing that they are not getting the care that they typically get. As you were used to your pediatric caregivers, you were used to the PT, you were used to the way they spoke and the way they communicated with you. So this is the time when families face challenges so much in understanding, who do I go to? What do I do now? What happens to the insurance? And that's one of the biggest things. It ends up where there is a gap in service. And that's why we want to be prepared so that it doesn't happen. When is the best time that you should start preparing your child? According to the American Academy of Pediatrics, transitioning should begin by age 12 to 14. That's when you begin to plan for it. I know some people may think 12 years old, but at this stage, you're beginning to help them build some skills. It could be fun, it could be stressful, depending on how you manage it. As a caregiver, you're going to hold yourself back. You're going to allow them to begin to build the skills of being an independent person, of being an adult gradually. Between that age 12 to 14, we begin to plan, and doing this reduces the gap that we're talking about. We start to teach them some things, how they can understand their own condition, how they can understand their medication, how they can understand scheduling their own appointments, and speaking to their caregiver or to their provider. These skills are very, very crucial. So let's look at a timeline. Between age 12 to 14, they learn some basic skills that we're just talking about. Each child's developmental growth is different. There may be some children that are not able to do some of these things at this particular age and at this particular stage. You work with them according to their ability, because everyone's ability is not the same, right? So 15 to 17, they should practice independence. At this stage, they should know their medicine. They know what they're taking. But that's a process. And if you ask her, what does 65 roses do? What is that? Oh, I have issues with my body builds up so much of these spits or salivas or secretions. But they begin to understand that even during the ages of 12 and 14. And 15, 17, they know to say, no, that's the medicine I take. That's not the one I take. They learn to ask, is it time for my appointment? Should we schedule my appointment? At 17, 18, I had my daughter understand that, okay, you have an appointment coming up. She may not call. I made the appointment because I was still struggling with letting go. But that's really a good time to have them call the doctor's office too. At 18 to 21, there's a full transfer to adult providers. Insurance begins to shift. And some of our kids that are on Medicaid, they may stay on Medicaid. Some of them, the waiver program may shift if they are, maybe they were on GAP. Now they're going to perhaps ICWP or the noun and the CUMP waiver, which is a big one for a lot of the children with developmental and behavioral issues. So things begin to move at this moment. And that is the time that could be very stressful. But if you had started this preparation on time, you begin to identify the PT, the OT, the home care agency, the physician that's going to be helping you during this period. And by 22 to 26, we expect full independence. Help during the scheduling of appointment. Talk to them. Okay, do you have classes tomorrow, or you don't have classes? We're going to be going to a doctor's appointment. Involve them. And then around that age, 18, let them carry their own insurance card. 17, 18, have them carry it. So I made copies and I had them carry a laminated copy until it got to the stage where I could hands off completely. So that's one of the things, the stages and little milestones you can work through with them. So when we look at the structured, timeline with the milestones, tracking your own progress helps you as a family. Are you doing well as we're getting to that stage and that age? Are you completing the necessary steps? So you want to help this young person as you go to the doctor's appointment, hold back the urge to speak first. Allow them to speak first when they get there. Practice these at home. You can talk to them about when you go, say hello to your doctor, and they're going to ask you, these are the nurse practitioner, or the nurses, or your PT and OT, whether you're going to therapy, or your home care nurses and caregivers. These are the things you want to talk about. Practice those, ask them some questions and have them answer. And one of the biggest things for parents is respecting privacy. At a certain age, you're like, I've been taking care of you all your life. Why do I have to step out? There are some times when we will ask you, can we just talk to them alone? Because they may actually open up more to the provider than if you, the primary caregiver, is in there. So you want to respect their privacy, give them that. Around that age 7, you will be surprised. From 12 to 14, they begin to be conscious, and they want their little privacy. Give it to them when they are there. Step back a little bit. It is hard. That's why we're practicing. That's why you take time to get to do this. So that when it comes to the stage where you have to be hands off completely, you are ready. Encourage responsibility. It's a step-by-step process. None of this happens in one day. It takes time. And introduce them to their caregivers, to their providers as you are transitioning. It doesn't mean that you're no longer mom or dad. You are the primary caregiver. You know your child more than anyone, but you are getting help in order to help them grow, to help them become independent, to help them continue to receive the care just in case you're not here, so that you too can get a break. So you want to introduce them to their providers. Model problem-solving skills for them. These children, they see you. What you do is what they do. If you stand back, you may be surprised to realize that the way you speak to the providers, the way you're speaking to people, they've mastered you. They've been looking at you all their lives, and they've mastered how you talk, and that's exactly how they're going to approach people. That's how they're going to approach situations. So you want to model a problem-solving skill. Let them know if, okay, something happened, this medicine is not available, or we're not going to see them today because you came late. That's another thing that families have to understand with a lot of the appointments. If you come late and they say this and that is going to happen, how are you handling that? How do you deal with that? How do you solve the problem of, oh no, we called the pharmacy, medication is not there, maybe sent to the wrong pharmacy. How do you deal with that? So that this young person now knows, okay, if this ever happens to me, this is how mom or dad or auntie or uncle or grandma dealt with it. And that's how I'm going to handle it as well. Medication management is a big deal. They should, between that age 12 to 14, they should know their medicine. So for us in the home, if we are providing services in the home, we make sure that we have a medication tracker. We have the list of medicine, the dose, and the schedule. Our caregivers use that, but we can also share that with the families that need it so that they can use it for their own children, so that the child can come and say, okay, I'm supposed to take ABC in the morning before I go to school. When I come back from school, this is the one that I take. And if someone tries to give them something else, they're like, nope, that's not what I take. And people stop and listen. That's them really taking control of their own health care. That's another thing. And keep that med log at home so that the child knows and they understand when these medicines stop. The doctor stopped this medicine. I'm not supposed to be taking this one again in case someone accidentally says, oh, this is your medication. No, they know because you've walked through this with them. in this process of transition, you want to make sure that you have open communication as you figure out who your child's adult providers will be. Begin a conversation between the providers, the pediatric providers, and the adult providers, so that there is transition of history, there is transition of medications, of all kinds of things. Because if the other people are coming in, if the adult providers are beginning service without a clear understanding of where your child has come from, there's going to be a gap. There's going to be issues. It's going to not flow the way that it should flow. So begin now. Talk to your pediatrician. They can give you a referral to an adult practitioner. Your PTOT can give you a referral to adult PTs and OTs. All the people, but your pediatrician is at the center conducting all of these, so they should be able to guide you as well. We want to make sure that there are no gaps in services. We want to make sure that your child didn't just lose their insurance, because this is one of the biggest things that I'm finding now, that mistakes are being made. Children are being removed from the insurance that they should be to another insurance, and it's taking forever to try to navigate them back. And during that process, they can't get their medicine. They can't get their home care services. They're not getting to see the doctors they should. And that is not good for the well-being of the child. So effective communication will reduce all of this risk that is associated when we're transitioning your child. It'll make sure that there's consistency in their care. Another place that you may not think of, I think sometimes parents don't think about the school and the community as part of the process, but schools do have some resources that they can help. Talk to the teachers. If your child is in a special needs class or special programs in school, talk to them. They have some resources that can help you, especially with critical support for services that you need, social integration for the child, and they help to develop some life skills during that transition period as well. Collaborate with the school. Collaborate with the community, with all of the resources that are available to you. It can be overwhelming, but when you start on time and you start early, it makes it so much easier, and you're communicating with your people. I tell parents, nobody knows your child more than you. No one. So your job during this process is advocacy. You understand your child more than anyone else. Effective advocacy at this point includes understanding the rights of your child, communicating that clearly with the providers, and ensuring that the child's preferences and needs are heard and respected. If you don't advocate for them, no one else can advocate for them as much as you do. You speak for them as they begin to get into this space of autonomy. You understand where you have been. You understand how much you've worked with this child to this point. You understand the sleepless nights. You understand the pain. You understand. And you've done a great job so far. And you have done well. Please communicate clearly and respectfully with the healthcare providers, and give them information that will help them to do the job. That helps in order to develop a plan of care, to say, okay, this is where we go. This is how we navigate this space. Advocacy also includes listening and respecting your own child's preferences. For those of you who have children, you want to listen to them, listen to their own preferences. Let it not be about you, but let it be about them. So some checklists. Okay, identify the adult providers on time. Talk to people, even other parents. And who do you see? Let them tell you, because it helps. The other person might be at a different stage and they've identified some practitioners or some providers that work for them, and you get to get that information from other people that understand your process. Have a medical summary, and we'll talk about what the medical summary should include. Have it built together so that you can share. And make sure that you have looked at SSI and SSDI if your child is eligible. What is happening during that period? Where are they transitioning them from one kind to the other? And then the biggest issue is the guardianship. I've had parents say, so-and-so cannot really do nothing. My child cannot do for themselves. Why are they saying I can't, I have to relinquish my authority, or I have to sign this paper? Why is guardianship part of the equation? As a guardian, I cannot do this, I cannot do that. There are alternatives. Speak to your social worker. In fact, it's a good time to involve a lawyer who understands some legal things that they may help you through this process as well. So the medical summary that we're talking about, the sample of this medical summary is that it should include stuff like your child's diagnosis, medications, allergies. There are providers. When they go to the hospital, which hospital is close to you, and how many hospitalizations have they had, the history, whether they're there because they had surgery, or did they get into the hospital often? When was the last time they were admitted in the hospital? You want to have that information to share with the providers during this transition period. Insurance, another big deal. We've been seeing so much issues during this period with a lot of our children. And transition involves adjusting insurance coverage and addressing those legal challenges that we just talked about, such as guardianships and consent. Being informed will really help you so that you can avoid the gaps in services. So you want to talk to case workers and make sure, if it is Medicaid, who your child's case manager is, and understand what's going to happen with that process of transition, what's going to happen to their insurance policy, what's going to happen to their benefits. Talk to them and begin on time. And then concerning the legal issues like the guardianships and the consent, how do you deal with that? I really recommend speaking to someone from the legal aspect. You talk to your lawyer, or the care management organizations can help you. Some of the resources that I have for you, there is an organization that helps in putting these information to them. Doing this will really help to avoid the care gaps. And so you want to be proactive. Don't wait for it to happen. Don't wait for that time when you wake up and they're like, oh, tomorrow your child no longer qualifies for this and that. And then you're running up and down. Insurance changes at age 18. Prepare for changes in privacy and decision-making rights. And it's a legal thing. You can't go around that. So you need to be prepared. At 26, be prepared for changes in insurance coverages and costs. Because remember, under 26, they can be on your insurance. If they're not on Medicaid, they're on your insurance. The cost is different. And then as they approach that age 26, cost changes. So both milestones require advanced planning in order for you to avoid the gaps in services. And so look at options like Medicaid, the marketplace, look at your employer. If your child is being able to work, because some of them, even with developmental problems, I love that even with their stage of their skills, they can still work. My daughter, she asked me one day, she said, can I experience what it feels like to work for someone who's not my mother? I was like, sure. So she applied and she got into Pittman. So the day of orientation at work, she came home and she said, look, I don't understand what this is. And they offered her insurance. And we looked at it, but because our insurance was so much better, I didn't want the little money she was making to be taken. I kept that. And I said, well, I explained to her, this is what it is. If you had to choose your own insurance, this is what you would have had to do. But because mommy and daddy, we cover you already with our company, you don't need that. So this is some of the things that you want to do with your young person. There's a different way when we're talking about alternative to guardianship, supported decision making. So you're sharing the decision-making agreements, and there are some state-specific resources, and a lawyer would really help, or some advocates, those advocacy organizations that do prepare you for that. Because during this period, you understand your child's developmental age, and you can say, okay, they're not completely at the stage where we should give up complete authority to them, but we're going to share this decision making. by doing so, you still promote dignity and independence for them. So this is something you want to consider, the shared decision making. Support them, because it's a hard time for them as well. It can be stressful for children as it is stressful for you, the parent. So provide emotional support for them, counseling resources, peer connections, have them, in their little peer groups. It promotes resilience and positive adjustment. So you want to make sure that you use these resources. The school, they have these resources. Make use of them. Have your child connect to other children in their age and going through maybe the similar situation that they're going through. And it really does help. Everyone needs support. So let's look at the coordinated care team. Your primary care provider, I always say they're like the conductor. So think about a choir. You have a conductor at the center who's doing all of that thing. I can't sing, so I can't really say, but I do know they move their hands a certain way, or an orchestra, and everyone has to play to a certain tune. But you have someone who says, play here, play that. That's what your primary care provider should be. Whether they're a nurse practitioner, whether they're a physician, and they're the primary provider, that's their job. They're the ones to refer you to the specialists, the therapies, the social workers, and then you and your youth are all involved. So this is your care team, but your home care is part of this as well. And you want that because that community care really does help you. So how do you select an adult healthcare provider for yourself? I say always choose people that are experienced with special needs adults. Ask questions, okay? Select them, ask them, how have you been dealing with children with special needs or adults with special needs? Are they able to put together a comprehensive care that is tailored to that individual's health conditions? So you want to make sure that there are care plans that are customized to meet individual health conditions and personal preferences. Don't just choose anyone. Every provider does not provide for everybody. Ask questions. What's your experience with young adults? How do you coordinate with specialists? Because you don't want someone that you're going to say, I need to see a dentist or a cardiologist, and they don't know what to do and they don't know how to communicate. What support do you recommend? Do they understand what all of this is about and how can they support your young adult? So we're talking about managing ongoing medical information. Make sure that you maintain comprehensive medical records so that there is accuracy in the continuation of care. The patient history will be the one thing that supports the next provider to know what to do next. Make sure that this information is accessible. I always tell parents, talk to us. Tell me what happened the night before, what happened before now, because if I don't know where to start. It's like when we go in the hospital in the morning, we have to do a change of shift report because the previous person needs to tell us what happened the night before so we know where to begin. That's the same thing with you. Keep up-to-date records, and this empower your new providers to make timely and informed decisions. Monitor your progress and adjust the plan. Nothing is written on stone. Continue to review the health outcomes. How is this process going? Are there things I need to tweak? Are there providers that I may need to shift and change? And it's okay if someone is not meeting the needs that you were expecting and you need to make changes, make it now. Adjust. Continue to review your plan and your process. So what have we talked about? Start early, start early, start early. When you wait, when you're not proactive and you're waiting for these things to happen to you, it becomes stressful, it becomes difficult. Transitioning from pediatric to adult healthcare is very complex, but it is achievable. When you have proper preparation, you have the right support and coordination. And when you empower, what my job is, my position, and many of the providers is to empower you as a family member to collaborate with all of us to ensure that your child, your medically fragile child, or your child with special needs continue to receive the right care so that they can thrive as they grow. So help them build independence. You advocate for them and help them develop their own advocacy skills. understand the insurance and the changes that will come, and create a strong coordinated care team. You should be able to pick up the phone or send an email to your provider, PT, home care, your primary care, and they should be able to answer some questions and help you. Even if they don't know, give me a moment. That's what I always say. Let me check. Let me send a message to this person and that person, and I'll come back to you.
Thank you for listening to this episode all about the transition from pediatric to adult care for caregivers of children with disabilities. We hope you enjoyed it and learned everything you need to know about this critical time in your child's life.
This was BDI Empowers, your guide to independent living. Join us again next month to learn more about simplifying disability benefits.